it would be nice to maybe just prepare yourself mentally. Maybe you can have just a quick rubbing your hands, or maybe a bit of stretch, something that, or just a bit of twist to make yourself feeling grounded, and then put your hands there. Should I apply a deep pressure or normal?
Like a handshake.
Like a handshake, yeah? Good. How do I know that the person is actually relaxing? Really. Fantastic, great. Usually the hardest thing in the hold is to keep it for enough time. Most people want to start right away. Sometimes the client would be agitated, like, why don't you start? Yeah? So just be aware of it, and then maybe if you feel that they are moving, then leave it. You can't do it. They don't like it. You come into here. Can I have an oil, please? Yeah. Oh, thank you. Oops. Good, thank you. I've got it. Good. Can I undo the bra?
Yeah.
So, good. Now I'm gonna throw two names of two techniques, but actually we've done it yesterday. Remember this technique? Yeah. How did we call it before? Stroking?
Effleurage.
So now we call it effleurage. Effleurage is, hold it like, it's a French, but it's part of the Swedish massage. Okay? So effleurage. Effleurage means to stroke. It's going to be on the video, don't worry.
Okay.
So effleurage, what do you think the effect of it?
Soothing.
Soothing, relaxing,
Yes.
definitely.
Blood.
Increase the blood circulation of the skin, around the skin. Spread the oil. Maybe warm up the skin as well from this friction. Yeah. And you enjoy it as well. Very important. Make it your own. Don't make it like robotic, monotonous. You know, if you want to just make it a stretch for yourself. Okay. The second one is called kneading or petrissage. Petrissage is to move the tissue. So here you go deeper and you really remember the muscles here. Yeah, you really try to move the tissue. Come a bit closer. I want to show you the difference between the effleurage. So effleurage is really gliding on the skin. You don't go deep. Although sometimes you can have a really deep effleurage. Yeah. So we're not really we're interested in knowing the differences, but it doesn't mean that you cannot blend those. You can do very deep effleurage, but usually effleurage is superficial. The petrissage, do you see the difference in the petrissage? Do you see that I'm trying to move the muscles? Yeah? So you're moving the tissue. Gliding is not the same as moving the tissue. Yeah? Here, or looking at here on the trapezius muscle. You're trying to move it.
Does it usually circular?
No,
No?
no.
Okay.
It can be static almost.
Oh, yeah.
It could be one side or the other one. Yeah? Okay. So in petrissage, there were few. Remember the tip of the fingers? It can be with one hand, but I like it to be reinforced reinforce them, and see that the base of my wrist is not up. It gives me a support. So I'm like cupping my fingers and digging into it. You can do it with the base of the wrist. Again, then try not to lift the fingers. Yeah, it has happened. So really try to move it. Move the muscles here. You can do it with a kneading. So one hand after the other, alternating hands. Or you can do it more with what's called ringing. Like you have a ring, you create a ring around that. You can do it here, you can do it here. So really go deeper. Yeah? Really go deeper. How's the pressure?
Perfect.
Yeah, good. Okay. So, so remember again, hold, effleurage, and petrissage. Now, what do you think about the idea from the hold to go directly into the petrissage? Too rough. Yeah. So again, we're not teaching you a sequence, but there is some sort of a logic. Start slow, move into deeper, and then take it further. Okay.
What's the
So
effects of that technique for Petrissage?
the effect of petrissage is a few. First, you really improve the deep blood circulation. Imagine a muscle is like a towel. Yeah? So a muscle build up of fiber. And the fiber, I mean this towel made up of cotton fiber, the muscle made up of different fiber that later on we'll talk on weekend 3 when we do the muscular system.
Okay.
But around this fiber you have all like blood circulation, you know, like vessels coming in here and in there. Now if you press and relax, this is what actually you do with the petrissage. You do that, you're stretching it, do that. Then what you do is you improve the pumping effect of the blood onto that area by the effect of pressing and relaxing. Every time you press, you're squeezing the fluid out, and every time when you relax, the new fresh fluid come, like blood, fluid, I mean blood, come into that area. Yeah? We'll talk more about that. This weekend I try to keep it kind of light with that, but
Okay.
it's a good question. So this would be one effect, and it will also reduce the pain around sore muscles. So back the base of the wrist, yeah, finger, kneading, yeah, and look more into the body. Not only, I don't do it this way. Yeah? It's a whole body movement. And even ringing. Yeah, and feel the warmth there, okay? And kneading with the base. So I move in. The moment I need more force, it means I need to move in. It's like trying to push a wall. You can't go backward. You need to go with it. Yeah? Okay. We'll do more later, but what I would like now to do is concentrate on the neck and shoulder. Okay? So, what I can do is first take the towel this way. Why do I do it? Keep it warm. Fantastic, yeah? That's why you need 2 towels. You can glide the 2 towels, and we'll teach you more towel technique later on. And now, let's change, please. You can come down, and I'm going up. Now, I'll show you a few specific Effleurage techniques. Now, I have a bit of problem here because I don't know what to do with the oil. I can put it down, but then I have to go up and down all the time. I can put it here, that's okay, but I wouldn't like to put it here. So you have to find a place that you always remember, but still, you know, protect your client's dignity and really think where you're putting it. Okay. So the first effleurage, called the diamond effleurage, and it has a diamond shape. It may look easy. Stay with and try to learn that. Okay. So it goes like that. You're coming upward. You take finger to fingers. Bend your knees. And then bring it back and go all the way up. You want to do it together with me? Yeah, so hands forward. You're taking it down, bringing it back towards you, fingers to fingers, bend your knees, wrap it around and bring it up all the way and hold it at the edge of the hand. Yeah, once more. Yeah. Bend your knees, fingers to fingers, wrap it back. Good. So you're trying to cover really as much surface as you can. Now, do you think that this technique would be nice?
Yes.
Yeah, but look at my hip now. Not very good. So if I want to go down to involve that, it's a lot harder because now I need the step down to the side. So can you look at more my leg? If I want to do the whole back, I can do that. Now I need to go back to here, then down. And again, look at the leg. It's a small step. Step, down, coming back and down. Because what I see is people start doing that and not good for the back, okay?
Could you see that one more time?
Yes, again. So, to the side, step, step, down, up. So it's 1, 2. So these legs movement are very important because they put you in a position that it's easy for you. Especially if you're short, it's very important that you use wisely your legs. How to position yourself, where to put it, okay? Okay, so this is the first effleurage. The second effleurage is more to the side. So I'll do it one side. So you just basically put your hand there, and then you lean to one side. But you go then all the way to the head. Again, from here, go there. Good. In reality, you do it on both sides. So you do that side, and when you come back, other side. Side. Every time, very slow. So really here you're starting with the whole of your wrist, and then on the neck you actually end up with your fingers because it's a smaller area.
Can you just talk about what you're actually doing with your body as well?
Yes. So actually it starts really with the body. I don't do that or moving my shoulders. No, it's not. It's actually leaning, and because of that, the hand go.
Would it be wrong to do it, say, 5 times one side, 5 times the other? Should it always be alternate?
I would suggest yes. I would suggest
Always,
alternating.
always.
Yeah. You can start by learning, you can do it one side, but really you need to do it on both sides fairly comfortably. Okay.
What about the pressure? Or it's just like a stroke?
Try it. You know, try it and see. I would say that it is still effleurage, so it's quite superficial. Okay. Now, Petrissage. Now, they come closer and see. When you treat the back is very squarey. So it's not so much of a problem because you just go up and down, side to side. This area, do you see its kind of contour? It has a curve this way, going down, yeah? And you have a muscle here. Do you know what's the name of this muscle here? Is this muscle here? Trapezius. Have you heard about trapezius? No? So we will talk a lot about trapezius because that's a muscle that a lot of people suffers ache from there. So you have the contour from the back going on the top and to forward, and you have the contour from the shoulder. Look, it's like a half a bay, you know, going up into here. Also consider that shoulder very strong, ribs underneath here, scapula, a lot of strong bones, and then very quickly you get into a very delicate area. So you need to, it's almost like day and night change fairly quickly. In this area you can put more pressure. This area here, not that much. You have to be careful. Okay, so let's think about, we did the two types of effleurage. Remember the diamond effleurage and the side-to-side effleurage. Now, last thing, and then I'll let you practice, is Petrissage. So you can do that coming in few different ways. First of all, you can stand on the opposite side to the side that you want to treat. So it can be here, and then I treat it. Now, look what happened to me. Do you see what happened to my back?
You're twisted.
I'm twisted, not good. So I need actually to change and put my, remember the 4 points, into that direction. That is a lot easier for me. So I'll do it again. I'll do that, and now I need to twist. There is no 4 point. These 2 points facing this way, the hip facing that way. So you need the 4 points to be on the same direction. Yeah? So what is it? Hold, effleurage, or petrissage now? Petrissage, good. I'm trying to lift, knead it, move it, get the blood in and out. I can do it slower, but I definitely want to kind of squeeze it out, you know, squeeze the blood out. Yeah? I can do it with the fingers and the thumbs, yeah? Or I can do it just with my fingers. Which one do you prefer, Rosa?
First one.
The first one. Okay. Okay. So you do that, or try to do both. Now try not to lift that.
Is that called something or not when you do that?
It's a finger kneading.
A finger.
Finger kneading. You knead with your finger. Yeah. However, can you see the small difference between that and that? What's the difference?
One's circular, one's pulling.
No. Again.
No, I'm just trying to...
Just a sec, just a sec, just a sec.
Oh,
See,
you're in the
please.
same place.
See, please. No. Between this one and that
You're
one.
moving your body.
Yes. I move my body. It's the difference that I really want to stress. Yeah? It's both the same, but now I use my body to do that, not my shoulders. Again, from that one and that one. I move my body. My body goes that. It's not my hand. Okay? Then you can come from above. You can use now the base of your wrist to come above and do it from here. Yeah, here you can do one side at a time. Again, I'll show you two differences. So one way is that, and the other one is that. What's the difference? Good, okay. So really move your body with it. Okay? And the last one is coming from the same side and do the same thing on the same side. Now, what is it important? It's important for you to know as many different ways to do the same thing. So if you feel tired doing one side, then you can do the other side. And there are small changes. You can squeeze it. Then you're coming to the neck. The neck is quite simple. You just do with your fingers. Alternating hand. Try to avoid pressure down. This way, you can more squeeze and lift it, yeah, as much as you can. Yeah, you can do it from here, you can do it from here. And then go really all the way until the muscle meets the skull. Very, very good place. Very good place. Yeah? When this is where a stress headache starts from. When the muscle meets the skull itself. Yeah? So try that. Both me and Alison will go around and help you with. Nice to finish with a few nice effleurage, you know, and then nice hold. Yeah, I think it's enough. So shall we